planning for our next classroom experience, we often spend hours pulling together information so that we can create the best learning experience for our students. Have you ever thought about what it would take to be the perfect nurse educator? I do say that in air quotes, and I'm sure it caught your attention because I do want to dig into this notion of our desire to be perfect, or at least to be the very best educator that we can be in the classroom for our students. Welcome back, everybody, to Dr. Siller's Educate, where our mission is simple. It is to support all nurse educators on their journey to achieve excellence and to achieve certification by NLN. Make sure you subscribe just in case this is the first time you are tuning in. We always like to start with our thought-provoking question, but before we start there, I wanted to have a little bit of fun with some of the graphics that we have discovered. This is just a way to increase engagement with our learners. And as we transition and taking a look at our thought-provoking question, I want you to consider trying new technology. I know it can be challenging, but I do think that as we are able to engage more with our students and meeting them where they are regarding the challenges that all of us experience from time to time with technology as we seek to engage our students. So what does that perfect nurse educator look like? Well, it allows us to engage in these lifelong commitments on this journey to help our students become the very best self that they can. All right, so let's take a look at our thought-provoking question, and then we'll go back to talking about technology and its role in supporting the learning experience. With the rise of online learning platform and streaming services, how can educational content effectively reach learners in remote or underserved areas? A, by partnering with local educational institutions to establish physical learning centers in remote areas, ensuring direct access to resources. B, by leveraging satellite internet technology to deliver high-speed internet access to remote regions, thereby enabling seamless access to online educational content. Or C, by implementing innovative online learning platforms and streaming services, thereby overcoming geographical barriers and providing equitable access to educational resources. All right, so I'll give you all a second just to write down what you think would be the best option or the correct answer for this question. All right, and we want you to do two things before we go any further. Number one, we want you to print out that study worksheet that's listed right here in the description. And number two, we want you to pull out Billings and Halstead Teaching and Nursing. These are two great resources that are going to help you close your knowledge gaps and show up more confident in the classroom and ultimately help you achieve competency and pass the NLN certification exam for nurse educators. All right, so that's what we want you to do right now is just go ahead and write down what you think is the correct answer to this question. And then we will go back to this question or the answer before we wrap up our time together today. Okay, so let's jump into our content as we continue to take a look at how to engage as a lifelong learner with our students and meeting them where they are. It requires quite a bit of discipline, but it also requires us to think about the challenges that our students are having in order for us to meet them where they are. So this notion of being a perfect nurse educator, well, there's a whole lot more to it. It's really about mastering the art of teaching and nursing. What do we mean by that? Well, perfection is not an act, it's a habit. The more that we are able to engage in implementing these evidence-based practices in how we teach, what we teach, how we evaluate, the increased likelihood we are to be able to demonstrate these behaviors naturally. That's right. They no longer become part of our script or part of our plan. They're just part of the natural engaging experiences that we have with our students. That's our ultimate goal, to be able to create this learning experience where students show up ready and fully engaged to provide the engagement that we need so that we can validate that learning has happened and we can truly become that coach or that guide on the side, right? We don't want to be that sage on the stage. What else do we know as it relates to engaging as a high-functioning nurse educator in the classroom? Well, it's about becoming a professional in our field. It is the difference between being a good teacher and being a great teacher. So, what does that look like? Well, first, when it comes to the CNE exam, we want to move you in a direction to support you on this journey so that you know studying is really about moving to that highest level of competency, which is mastery, and to the point where failure is no longer an option. So, what does that look like? Well, first and foremost, what it looks like is following our 7-week study plan, being able to engage in the CNE in 60 days journey so that you can feel confident that you are competent in achieving all of these competencies. Looking at competency 1 in the on the NLN CNE test blueprint, looking at competency 1 in CNE-CL and competency 1 in CNE novice. I want you to think about, as you're looking through those competency statements, think about how you are able to demonstrate these behaviors right now in the setting that you are teaching in. And if you are not there yet, so if you feel like you have some gaps, I want you to think about the difference between knowing and perfecting the content mastery that we're able to engage our students in the classroom. So what does that look like? Well, on one end of the spectrum, which is knowing, we are competent as it relates to the concepts that we're teaching about, right? We understand, we've had firsthand experiences of the content that we are teaching our students about. Now we want to transition into that ability to inspire, to motivate our students, higher level of mastery where students are truly comprehending these concepts in a way that they're able to apply them and analyze them. So on the left-hand side, we are focusing on that amateur level of study strategy, right? Where we are focusing on what is it that the content that I'm teaching about? What is it exactly? And I want to make sure as I'm teaching them about blood flow through the heart that I know where that blood flows from, right? I know that it goes from the right atrium to the right ventricle. And I need to know, okay, so what valve does it go through on the right side of the heart? As opposed to this higher level of mastery where I don't just aim for knowing the content, I aim for perfection by studying until I cannot get this content wrong. I am so confident and competent in my ability to engage the learner at that highest level, which is mastery, that I am showing up not only with textbook knowledge, but with that firsthand experience when students are asking me questions that I would not know the answer to as an amateur because I've only read the content. I only know from a context of the theoretical perspective of exactly what happens with the blood flow through the heart, as opposed to my ability to have mastered that content. I may have worked in the cath lab, or I may have years of experience where I have cared for patients that have had a blockage in their heart. And so I'm very familiar with those firsthand experiences as it relates to blood flow through the heart. Well, how is that going to show up in the classroom? Well, I'm going to be confident in my skills and the concepts that I am discussing. I'm going to increase my likelihood that I can have a natural flow into the conversations I'm having with students, as I may perhaps introduce an unfolding case study, right? I'm able to help troubleshoot and clarify questions that students may have as they are transitioning from that theory to practice mindset when it comes to taking care of the cardiac patient. What else is it that I want to consider? Well, the next components that you want to think about are going to be the specific art aspects of mastery. So that's a little bit about the science, but now let's talk about the art. Well, first of all, as an amateur, I study to learn, right? I find comfort in knowing just the facts, right? When we think about the COBE experiential learning theory, we know that's the assimilator, right? They want to see the information for themselves. We want to provide additional context for them, specifically page numbers, such as with Billings and Halstead, taking a look at chapter 14, table 14.1 on learning theory. You are going to see specific concepts associated with each of these learning theories, along with these underpinnings or principles associated with the learning theory. And last but not least is going to be those specific teaching strategies that are most closely aligned with that learning theory. Okay, so that's what you want to remember when it comes to how we think from an amateur perspective. And we know we can't stay there. We've got to be able to move to that higher level of mastery. And so we start to study and focus on those concepts that may be a little fuzzy for us, or maybe we don't have a strong firsthand experience. However, our goal is that we study until we are no longer able to get it wrong, because it's so natural when I'm standing up talking to students or when I'm sitting engaging in learning circles. I'm immediately able to think about my firsthand experiences because I have achieved this art of mastery that we're talking about, not just the science, but the art. And then it's all about practice making perfect, right? Remembering that when we talk about perfection, it is not just an act. It is something that is so natural because of the repetition that has occurred. And then last but not least is going to be my ability to engage in this continuous learning. This is the key. This is what I like to call secret sauce. It is collaborating with my colleagues, whether that's through scholarly work, where perhaps we're doing research work together, or it could be something as simple as attending a conference. We will be at the ATI conference in Salt Lake City and in a couple of weeks, and we hope that we will meet many of you all there. But engaging in conferences and collaborating with our colleagues is a wonderful opportunity to engage in this continuous learning that Malcolm Knowles talks about. Now, this is a quote that I really like, and the original author is unknown. However, there have been many coaches and other leaders that have quoted this saying: amateurs, they practice until they get it right. Professionals practice until they can't get it wrong. It's a natural ability for us to show up in our students' learning environments, whether that is the didactic or classroom setting, clinical or SIM setting, right? We're able to engage students in a natural way that allows them to decrease their anxiety, because we are coming from a place of competency, and automatically we're going to have an increased level of confidence so that we can best serve our students. All right, so now let's go ahead and go back to our thought-provoking question and see what you all chose for the correct answer. All right, so here we go. If you chose C, which is by implementing innovative online learning platforms and streaming services, thereby overcoming geographical barriers and providing equitable access to educational resources, you are correct. This is the most effective way to reach our learners in remote or underserved areas. All right, so if you did not choose that answer, we do not want you to be frustrated or discouraged. This is what we want you to do. We want you to take out your practice, your study worksheet if you haven't already, and we want you to write down exactly what was muddy about this concept that we mentioned. Okay, remembering that our strive to become the perfect nurse educator is not about a destination, right? It's about a journey where we're engaging with our evidence-based practices and implementing those in the classroom, where we're trying different technology so that we can experience what that feels like. Okay, so we're using right now Prezi as our background and as well as our presentation content. And then you also want to just do that self-assessment every single semester is my recommendation, where you're thinking about what your gaps are and how you're going to close them. Our content today was aligned with Competency 1 for all 3 exams, and what you will find is the more we can engage as a facilitator of learning, as that coach, that guide on the side, then the more increased awareness we're going to have about our knowledge gaps. All right, so reach out if you have questions, info@drsellerseducate.com. We look forward to seeing you next time. Have a great one, everybody.